Welcome to Mountain Health Today. I'm Ted Owens, your host. Brought to you by the Tahoe Forest Health System, serving the greater North Lake Tahoe region. And my guest host today is Dr. Brian Evans, Chief Medical Officer of the Tahoe Forest Health System. Brian, thank you very much for making the time to join us today.
It's great to be here. Thanks for having me.
Glad to have you. So today we're going to talk about something that I think we'll have a good time talking about. It's winter holiday wellness. And there are a lot of things involved in that regarding not just common sense, but behaviors and what have you. So what do you think we're going to hit on today?
Well, you know, I come at this from the perspective as an ER doc, right? I practiced in the emergency department for about 15 years. And, you know, every year around the holidays, Thanksgiving, Christmas, and other wintertime holidays, we will see an increase in certain kinds of things. And I have to say, a lot of it is preventable. You can certainly prevent some of the accidents and some of the medical things that occur as well, just by using common sense and making good decisions. But it's tough, and I'm right there with most of our listeners because I too like to overindulge a little bit around Thanksgiving, especially. My mother-in-law makes a lot of really good pie, and I end up eating every different variety of
Slice of each one.
Slice of each one, yeah. But there's definitely things that we can do to try to prevent unexpected visits to the emergency department. We're there if you need us, but we'd prefer you be healthy. So certainly overindulgence is one aspect of it, but there's a lot of things we could do around safety as well.
Let's stay on the overindulgence for a moment here, because we exist at high altitude.
Yes.
Many of our visitors and second homeowners and what have you live down at sea level.
Yeah.
And that could impact your overindulgence a little bit unknowingly, correct?
Yeah, the altitude does cause problems for some people, especially people who are elderly, people who have other chronic medical conditions, especially issues with heart and lungs. So when you get up into the thinner air, you need to make sure, number one, you stay hydrated, you drink plenty of water, because it's very easy to get dehydrated at altitude. But you also might have more breathing problems than you would typically have. And then if you're doing things around the holidays that you might not otherwise do, traveling long distances or overexerting yourself, it can be a setup for problems. Of course, we don't just have the altitude, we also have the winter weather, and we are a more extreme environment than many people are used to. And so there's the hazard of potentially slipping on the ice. There's all kinds of issues with the snow that we need to watch out for.
Before we leave the altitude thing, we were talking about overindulgence just a moment ago. Alcohol consumption can impact people differently at altitude than sea level. Is that correct?
It can. It could hit you pretty hard. And obviously the holidays are a period of time where people do like to drink alcohol. And we just need to be very, very careful. Certainly, we want to make sure people are not drinking and driving. That's number one. But even if they're not driving, you can still get into trouble with alcohol if you do too much of that. It's much easier to fall down, just lose some of your senses, and you could end up with trauma. And it can also exacerbate medical conditions as well.
Now, a moment ago, you mentioned slipping on the ice. It sounds like a simple thing to us, not necessarily true. And I speak from experience. I slipped on a driveway once where it was ice and then went to asphalt, and I rode out the ice part. I got caught on the asphalt and tore about 40% of my quad tendon off the bone. So what are some safeguards when you're walking on ice?
Well, I've been told we should try to walk like ducks, and I think other people have different analogies, and I think that's good. You really want to make sure you try to keep a relatively low center of gravity, wide stance when you're walking. You don't, take long strides, you take short strides, and you really just do that. The other thing is, when it's possible, you really want to have 3 points of contact. So you've got your 2 feet on the ground, and then you've got ideally a rail or something you can hang on to when possible. It's not always possible. So when it isn't possible, you try to pick a lane where there's not as much ice or no ice, ideally, and then you got to think about what's on your feet. What are you gripping the ground with? Obviously, good boots are an important ingredient there, but there's also ways you can add spikes to your shoes, and I do recommend those.
Well, and let's not forget, don't walk on the ice with your hands in your pockets. Because if you slip and go down, you may not be able to break your fall.
It's true. And, this is obviously a big concern as we age, and we're all aging, obviously.
What?
It's true. And when you fall down and you're 20 years old, it's usually not as consequential as when you fall down when you're 80 years old. So we really do want to make sure that we're helping elderly neighbors, friends, and family so that they are avoiding falling. We're making sure that their walk paths are safe for them. There's certain things you could do with sand and salt to try to prep the surfaces, but certainly good maintenance is good.
And I would imagine in your career on the ER side of things, you've seen the results of slip and falls, and they're a little more serious sometimes than you might guess.
Absolutely. And at Tahoe Forest, we see really a lot of trauma related to falling down on the ice. A lot of upper extremity injuries, certainly hip fractures, head injuries, and many other things. So it is not a laughing matter. We definitely want people to be as safe as they possibly can be on the ice.
Tell us a little bit about our guest who we're going to bring in just a moment, Wendy Buchanan, because I think we're going to switch gears a little bit. What are we going to talk about?
We're going to talk about occupational medicine and employee health and all the different things that we can do to protect employees. If you are an employee for an organization or if you take care of employees at your organization, Wendy does a fantastic job for our occupational health programs at Tahoe Forest, which are extensive. And so she's really an expert in how to keep employees healthy, all the different ways that we can make sure they're doing the right preventative medical care for themselves, avoiding some of these serious problems before they become really big challenges.
Wonderful. So we'll be expanding on our conversation that we've been having.
Yes, we will.
So we'll look forward to that. We're going to take a break just in a moment here. But for the folks at home, thank you very much for tuning in to us today. This is Mountain Health Today. I'm Ted Owens, your host. My guest host today is Dr. Brian Evans, the Chief Medical Officer at Tahoe Forest. Brian, good to have you here, and we'll be back in just a minute. This is Mountain Health Today. I'm Ted Owens, your host, and of course I am here today with Dr. Brian Evans, Chief Medical Officer of the Tahoe Forest Health System. And Brian, we're going to have a guest today. We're going to talk about occupational health. Tell us a little bit about our guest and what the conversation is going to be about.
Well, I'm delighted to welcome Wendy Buchanan to the discussion that we're having today about occupational medicine, because occupational medicine is so important, but I'm curious to hear her thoughts on how the role has changed and the elevated level of importance of occ health when the pandemic hit and how critical it became for her team to help keep the rest of our healthcare employees healthy during this very difficult time.
Well, without further ado, let's bring Wendy Buchanan in. Wendy, good to see you.
Hi, thanks for having me.
Now, I want to get your title correct. You're the Director of Occupational Health and Wellness for the Tahoe Forest Health System. I got it right?
That's correct, yep.
Very good. Wendy, if you would, share with us a little bit about what occupational health is. What do you do there specifically, and why is it important to the community?
Okay, great. Yeah, occupational health. We serve our own employee population, so we provide all the regulatory screenings for our employees. We provide vaccinations, pre-employment physicals, COVID screening, COVID testing, historically, and as well as our Tahoe WoRx department. Out of this department, we serve all other local employers as well in the Truckee, Tahoe, and Incline area. To keep them safe and injury-free and productive employees.
So Wendy, when you talk about serving other employers in the region, what kind of services are those employers and those employees getting from Tahoe Forest, and how do they interface with the system?
So we provide regulatory screenings for other employers as well as wellness programs. So the regulatory screenings, those would be things like drug testing, DOT physicals, pre-employment physicals, return to work. If they've had injured employees, we provide all the workers' compensation, return to works, as well as first visits when employees get injured on the job. We can see them first visits and manage their care and get them back to work as quickly as possible.
And I'm going to jump in here, Wendy. That's inclusive of some rather important folks in the community. You serve, say, fire protection district, the police department, sheriff's deputies, in getting them back to work. Correct?
Correct. Yes.
Okay.
As well as any other employer, we have over 300 contracts with local employers in our health system district.
Before we switch gears, can you, if we have an employer that is not working with Tahoe WoRx, how would they get in touch with you? Where can they find more information?
Well, we're here at Tahoe Forest Health System. We have an office back behind the hospital, but we do have a web page on the tfhd.com/Tahoe-WoRx, where there's information, and you can reach out and meet with myself, and we can look at what is required for that particular employer. And we have 2 occupational medicine board certified physicians that work with our department, and we can sit down with them and look at what screenings would be appropriate and come up with a plan and set up a contract.
Thank you very much. We're going to switch gears. I'm going to go to Brian.
Yeah, I want to ask you, Wendy, about COVID and the whole pandemic and how things really shifted dramatically when that hit us in early 2020. And so it really became clear to me the role of occupational health was significant, and protecting healthcare workers became so critical. What was your experience?
Well, it was quite an experience. It happened really quickly, and we were required, healthcare providers were required from Cal OSHA and CDPH to not only test all of our employees, but provide vaccinations for all of our employees. And we also provided vaccinations for first responders in our community. And then there was also requirements around when any of the employees actually came down with a positive test. We had to report all that information out. We had to follow the guidelines. So whenever an employee was out, they were out for 10 days. We screened them, and we had a few nurses on staff that would manage a COVID call line, which in certain months in January of 21, we had hundreds of calls from employees. So it really did impact our department significantly. And we learned a lot through that process as requirements changed and our community changed. It was a really big learning curve for our department, but I believe we managed it really well, and we're to the other side.
Yeah. Wendy, let me ask you this. You've seen thousands of employees come through the clinic and be cared for. What advice would you give to people to ensure that they remain healthy for as long as possible and are able to be employed and stay functional at their jobs? If they're like me, they're trying to hang on as long as possible so they can retire at some point. But what would you tell those folks to stay fit and healthy?
Well, we do follow CDPH guidelines, and recommendations now is that everyone continue to get the COVID boosters when they're offered, as well as masking around high-risk individuals, and of course, washing your hands and all of those safety measures that we always recommend. And then the wellness side, there's always just staying healthy and having good lifestyle, exercise, nutrition, watching stress management, those sorts of things. So just getting enough sleep. All of those things are important. And following up with primary care provider if you are sick, or going to one of our urgent cares if you come down with COVID.
Wendy, thank you so much for taking the time to join us. We've been spending a little time with Wendy Buchanan, the Director of Occupational Health and Wellness at Tahoe Forest Health System. Wendy, I wanted to point out one thing on the pivot during COVID. The work that you all did getting teachers and all school district employees vaccinated in one day was phenomenal. So
thank
you very much for joining us today. This is Mountain Health Today. I'm Ted Owens with Dr. Brian Evans, and we'll see you soon. This is Mountain Health Today. I'm Ted Owens, your host, and I have as guest host today Dr. Brian Evans, Chief Medical Officer of the Tahoe Forest Health System, which produces this program. Dr. Evans, thanks so much for being here today.
Thank you for having me, Ted.
Well, it's wonderful to have you here. We're going to spend a little time talking about the season of giving as we approach the holiday seasons, and we're going to talk a little bit about some of the opportunities that might be out there for the folks at home. So where would you like to begin?
Well, I'd like to begin with the fact that I joined the system back in December of 2022. And when I came into Tahoe Forest, I was blown away by the level of support from the community. And it's evident everywhere. There's interest from the community in what's going on at Tahoe Forest. There's involvement, there's participation. But also, Tahoe Forest has been able to stay at the absolute forefront of all the advancements in technology that have come along in healthcare because of the support of the community. And a lot of that is direct contributions, but also assistance through our foundations, and we have two.
And you've been in Nevada County for a long time. I should point out to the folks at home, you're a trained emergency room physician.
Yes.
And you're on the administrative side as CMO, Chief Medical Officer today. Now, Tahoe Forest Health System is located in Truckee, but also holds the hospital in Incline Village. We're talking about two foundations, correct?
That's right. We've got two foundations, and yeah, we have care sites. I think we have over 20 care sites now. We stretch into multiple counties, including across the state line into Nevada. So it really is a complex, even though it's still a relatively small healthcare system. What's interesting about it is that when you think about who owns Tahoe Forest Health System, it's the community. I mean, this is a community-owned asset. Mm-hmm. So if you're a patient, you're a citizen of this area, or even a visitor of this area, this is your system.
So, and of course, it's a very expensive endeavor to provide health care out there in the community. So what is the role that a foundation plays, and why is it important to the health system?
I don't know that everyone is aware of just how challenging it is, especially in rural communities, to maintain a healthcare system or any kind of even a small hospital. And many rural hospitals have closed over the last 10 years in the United States, and many more are at risk of closure because it's very, like you said, it's very expensive. It's also very complicated. There's a ton of regulatory pressure on small hospitals. Tahoe Forest has done a really good job of navigating that complexity, but really it's the community that should be thanked for being so incredibly supportive of this system and continuing to support us as we deal with a very challenging environment.
And my understanding with respect to both foundations, the one in Incline Village, certainly a tremendous support of the Incline Village Community Hospital, but also the foundation over in the California side, is they enable the health system to take it a step above in terms of some of the things they support, like technology. Tahoe Forest Health System is state of the art, and some of that is over in state of the art in Incline.
Yeah, and some of the technology that's really required just to maintain status quo is very expensive, but we've been able to actually get really out on that cutting edge. With some examples would include our imaging equipment. Imaging equipment would include things like CT scanners, MRI scanners, mammography instruments, those types of things. We are bringing back mammography to Incline, for example, which is very important, with some of the best equipment that you can find anywhere in the world. So we're talking about millions of dollars to have these types of equipment around. So that kind of support is incredible. And since coming to the system, I've just seen evidence of that everywhere, from the cancer center to just all the devices that we use at the medical center. So really, really very appreciative of that.
So for folks at home, if you're interested in giving, well, there's many opportunities actually, but one that is coming up, and I'll ask you how it works, Brian, if that's okay. But Giving Tuesday, many of us have heard that term with many nonprofits and what have you. Our foundation or foundations are no different. Tell us about Giving Tuesday.
Well, Giving Tuesday, not to be confused with Cyber Monday or Black Friday, which are other ways to give money for stuff that you probably don't need and it's going to end up in the garage anyway. Giving Tuesday is a way to support nonprofit organizations, certainly including Tahoe Forest, and there's many other very good ones around as well, but we would certainly like people to know that when they do support our foundations, they're supporting patient care in this community for today and also the patients that we're here to take care of into the future. Really, like we mentioned, the survival of healthcare systems in rural communities depends upon the community support, and so we certainly appreciate anything you can do for Tahoe Forest on Giving Tuesday. And I think it's November the 28th.
November the 28th,
yes.
And equally important for the Incline Village Community Foundation as well. The Incline, stop. Give me a count of three. Also very important in Incline Village, two separate foundations supporting two hospitals. And these year-end donations, of course, have some tax benefits.
They do.
They are tax deductible. And to get more information, of course, tfhd.com/giving, and you can learn more about it. But I don't want to leave the subject quite yet. We've got a little bit of time. In your experience, having been in the industry for quite a while, is it common to see foundations supporting health systems in the manner that we're used to up here?
Not to the level that we see here in this community. We're really fortunate to have a community that understands what the mission is, the difficulty of that mission. Many of the patients or families that help us have been patients themselves, and they know how critically important it is to have top-notch technology, the ability to attract physicians and many other experts and retain them in a community like this. It's very, very difficult to do that, and so we're all in this thing together. It is your system. We work for you, but we can't exist without that support.
And a big thank you to those that have given, particularly those that have been patients and have a story to tell.
Indeed.
This is Mountain Health Today. I'm Ted Owens, your host, and we've been talking with Dr. Brian Evans, Chief Medical Officer of the Tahoe Forest Health System. Brian, thank you so much for being here, and thank you so much for tuning in.